Let's carry on down to the river and see what we can find.
The search is on for leeches, snails, and aquatic moths. For these young explorers, a nature walk along a river is a chance to learn the importance of protecting natural spaces and the creatures that inhabit them. The water here is pristine, but more and more, what lies beneath our lakes and oceans includes plastics, lots of it. It's the largest type of marine garbage. But it's the tiny pieces of plastics, or microplastics, that are especially concerning.
We see microplastics on beaches, in the water, finding them in places as remote as mountain tops and Arctic sea ice. They're in the air, they're almost everywhere.
It's easy to see the impact on the environment. It's not so easy to see it on us. Today, the World Health Organization weighed in, releasing its first report into what microplastics could be doing to human health, especially when they're in drinking water. Regardless of the size of particles, the risk is low.
For the larger ones, these would be expected to pass harmlessly through the body. In other words, they wouldn't be absorbed by the gut. And the vast majority of the smaller size particles would also pass through.
What's still not clear, whether the contaminants on or within the plastics are harmful. If so, the WHO says some of the levels are probably not high enough. The report says wastewater treatment can also remove more than 90% of microplastics. In this Toronto lab, researchers have collected hundreds of samples of microplastics in nearby lakes and harbors, looking for answers to and how they contaminate the environment.
We've only begun to understand what the effects are to aquatic species. Very little has been done to look at human health, but microplastics are getting into us, and it definitely warrants looking into and researching more.
The WHO agrees, calling for more research into microplastics, but reaffirming that achieving clean water around the world remains the focus. Cass Rusi, CBC News, Toronto.
One of the recommendations in the WHO report is that measures be taken to reduce the use of plastics, and Canada has already taken steps to do just that. A microbead ban went into effect last summer. That means any toiletries that contain the tiny plastic pellets like toothpastes and facial scrubs can't be manufactured or imported into Canada. Several other countries have also taken action, including the US, United Kingdom, South Korea, Sweden, and New Zealand. A growing number of countries, including Canada, are also cracking down on single-use plastics, which can break down into smaller pieces and wind up in oceans and waterways.